So vaccine hesitancy, something that we've seen not just in Kenya, here in South Africa as well, and other parts of the continent. Dr. Thierno Balde is the Incident Manager for COVID-19 response at the World Health Organization in Africa, and he joins us now via Zoom from the Ethiopian capital, Addis Ababa. Thank you so much indeed for joining us, and welcome to the program.
Thank you. Thank you. My pleasure.
All right, so where are we, do you think, in terms of this vaccination story? Because at one point we were hearing words like vaccine apartheid, where Africa wasn't getting its doses, and now we're getting stories of vaccines expiring. What has happened?
Yes, I think it's a kind of evolutive, situation. Some months ago, definitely there were no enough vaccines, and with all of the work which has been done by different countries and also by the World Health Organization and other partners, there have been this movement of really making available more vaccines. But with those vaccines, also there is another step, where we really need to undertake for trying to convince and explain, the usefulness and the importance of this vaccination in most of the countries here in the African region. And I think it's important to mention that the dynamic of the pandemic has been quite diverse, between different regions. And as we know, despite the fact that we know that there are some limitations in the health information systems, that the number of cases and deaths here in Africa has been quite low, around 3 and 4%, when we take into consideration all of the numbers in the world. So definitely the dynamic has been, the intensity of the dynamic of the pandemic has been quite different in the region here. All of these elements can explain the situation that we are facing now. But nevertheless, we are definitely convinced that what is really important is really to encourage people to understand, the behaviors of people. And changing the behaviors of people is not something which is easy. So a work needs to be done around that to convince, to explain, and to motivate more community members and population, to get the vaccines.
All right, so one of the indicators that we're seeing is that across the continent, countries have started to lift restrictions, and in some countries quite significantly, actually. Does that tell us that the COVID-19 pandemic, we're over the worst of it, and that it's something that is in the past?
So definitely we understand that all of the countries, both in Africa here, but here in the world also, has gone through those two very difficult years. And definitely there are some, needs for trying, to open economies and opening countries and lift some of the restriction. But as World Health Organization, as a normative and scientific organization, it's really important that also we really inform, the communities and the people and the countries about really facts and scientific facts. And for instance, it's really important that to have a more kind of, progressive manner in adjusting those different public health and social measures, because we know that lifting them all together at the same time is not the most safe or the most effective way, for really maintaining a certain critical capacities, for any new situation which can happen. And we have seen this pandemic has been very dynamic. We have seen, a kind of, peaks occurring in different periods of the year and given different situations, despite the fact that we are having all of this certain level of immunity. But it's really important not to lift all of these different measures, at the same time. So yes, for really accompanying and supporting countries in adjusting some of the public health and social measures, yes, in a phase mode, in a gradual manner, while keeping, some of the measures, some of the capacities to be able to respond wherever there is a kind of, upsurge of cases.
All right, so caution perhaps is the word that really needs to be applied here. What do you think authorities should still be doing in this era of less restrictions? Should we continue testing, for example, and contact tracing? Is that something that we need to keep on doing?
Yes, absolutely. We have to continue, but probably at different level of intensity and a different manner. Like for the testing and for the contact tracing, we really need maybe to do it in a surveillance approach to be able to detect new hotspots or maybe new cluster of cases. So we cannot stop all of these different elements. Otherwise, we cannot know what is really happening at the community level. So yes, conducting those testing, continuing the testing in a more kind of random manner, and also to try therefore to detect those new hotspots. This is something which is important. Maintain the capacities, the response capacities in terms of in terms of clinical case management, in terms of treatment of the patient wherever they got sick. This is something also which is important. And finally, obviously, talking and exchanging and interacting with the communities to explain to them that this situation is not over at the moment. And as we have seen, in other regions in the world today, in China, where we are seeing this uptake of upsurge of new cases, this might happen again. So this is really important to accompany all of these different interventions with very good communication, very open communication, very honest communication with the different communities.
I suppose also each country is unique in the way that they experience the COVID-19 pandemic. We've seen variants occur in different parts of the world. And so one, I'm guessing, really needs to be cautious in terms of what you do in your country going forward. Should people continue to vaccinate? Because one gets a sense that there is this idea that there's been a lot of people who've got natural immunity now, having had the virus already.
Mm-hmm. I think it's quite clear that it's important to continue this vaccination because the immunity that we can obtain or that we can acquire, through a vaccine where, we have a kind of more controlled, parameters where we can know maybe a little bit more with more precision about the level of immunity that we can obtain versus someone who is getting that immunity through a kind of infection. That infection can be mild, that can be severe, it can be really, different stages. So it will be a little bit difficult really to have that confidence in that type of immunity. So what is really important, and especially for the people who are the most vulnerable ones, let's say like the elderly population or people who are having comorbidities, really to go and to get vaccinated, including also the healthcare workers, really to go and to get vaccinated to avoid any type of, major situation where our health system can be really overwhelmed and, limiting our possibilities of both handling the COVID-19, but also other common, diseases and pathologies and epidemics which can happen at the same time.
All right, Dr. Balde, we're going to have to leave it there. Thank you very, very much indeed for that update. Thanks for your time.
My pleasure. Thank you very much.
All right, and that's where we'll leave that for the time being. That was Dr. Balde, who's the Incident Manager for COVID-19 response at the World Health Organization, talking to us about the relaxation in many countries of COVID-19 restrictions.